Access to emergency care in this country is severely threatened, and the current financial crisis promises to make matters worse. More and more people need emergency care each year, and yet each year there are fewer resources available. At the same time, emergency care has never been more important to the nation. I'm Nick Girelis. I'm president of the American College of Emergency Physicians. We're here today to reintroduce the Access to Emergency Medical Services Act into the new Congress. In the last Congress, we had 187 co-sponsors of the bill from both sides of the aisle, from both the House and the Senate.
The poll of emergency physicians of those that responded basically tell us that 80% are seeing patients coming to the emergency department that have lost their jobs and therefore their insurance, and this is clearly a concern given our overcrowded conditions already. 3/4 of emergency physicians are seeing patients suffering great medical emergencies because they are delaying their care.
We want to increase the Medicare payments for emergency-related care by 10%. Establish a commission to examine the problems facing emergency departments, such as specialty shortages, make recommendations to Congress. This is very important now because even though you may have an emergency room that's open, it's very difficult to get specialists.
This is such an important issue, and it's such an important part of the focus of healthcare reform in terms of looking at what's happening in our emergency rooms today.
The poll follows the release of a national report card on emergency medicine, and dismally the nation earned a D- in access to emergency care. 72% of the physicians polled believe that they have not seen the full consequences yet of the financial crisis on their emergency departments.
New emphasis is being placed on health care in a way where there now is more money available. I believe this is a priority. BARD believes it's a priority. And what we have to do, as in all cases, is to prioritize the money to the need.
We are asking Congress to hold hearings on emergency care and make emergency care a vital part of the health care reform discussion. If Congress fails to act, more and more emergency departments are going to close, and that's going to leave an emergency patient with no place to turn in their time of medical need. Go to ACEP.org and send a message to your legislator in Congress to protect your access to life-saving emergency care.